Postpartum depression is common, affecting between 10 and 25% of women following delivery. It can lead to a lot of complications such as severe depressive symptoms, higher maternal morbidity, and it can impact mother-infant relations. All of these complications may significantly impact the development of the child and leave lasting damage to the mother. Past literature has shown that certain individual differences in external factors may predict who will be affected by PPD. For instance, fluctuation of certain reproductive hormones such as plasma OXT may trigger the symptoms. There can also be external factors such as status as a migrant, spousal abuse, and physical complications in pregnancy. Past research has found that there are certain types of treatments that may be more effective than others in reducing the symptoms of PPD. For instance, women who breastfed exclusively for 3 months have reported significantly lower levels of PPD. Another very effective treatment is exercise. One important gap, however, in the literature is understanding which kind of exercise is most effective in reducing these symptoms. Researchers in this study want to know if high cardio routines such as running are more effective in reducing the symptoms of PPD than low impact exercises such as yoga. They put controls in place such as the duration of the workout and the number of times per week, and these findings help to make a case for the development of individualized exercise plans as a treatment option for depressed mothers. The researchers hypothesized that cardio will serve as the most effective treatment for PPD when compared to yoga and control groups. The null hypothesis suggests that the type of exercise will have no effect on the subject's level of postpartum depression. This was a between groups design composed of 3 groups: cardio exercise group, yoga exercise group, and a control group which did not participate in any exercise. The independent variable is the type of exercise, and the dependent variable is the levels of depression as determined by the EPDS. The EPDS is the Edinburgh Postnatal Depression Scale, which was a scale administered to participants in all 3 groups before and 6 months after beginning their exercise regimen. The EPDS is a self-report questionnaire comprised of 10 items aimed to assess the symptoms of depression within the previous 7 days. It includes statements such as, "I have felt happy," to which the users may respond all the time, most of the time, not very often, or not at all. It yields ordinal data and has good internal consistency and high validity. The population was made up of 200 middle-class women ages 18 to 28 who were between 1 and 12 months postnatal with similar education, employment status, marital status, and age. They were recruited using a convenient sample from a single maternity unit because it was easily accessible and allowed researchers to obtain basic data without the complications associated with a randomized sample. Data was assessed using the one-way analysis of variance, ANOVA, in order to determine any statistically significant differences between the means of the 3 groups. The one-way ANOVA was chosen because there were 3 levels the researchers wished to compare. And these results will be used to determine whether or not the experimental results are significant. Overall, the impact of this study will help to make a case for development of individualized exercise plans as a treatment option for depressed mothers, and help to contribute to a deeper understanding of the benefits of specific types of exercise for those suffering from PPD.